Dr. Primack, what are varicose veins and how are they formed?
A varicose vein is a bulging vein, generally in your legs, and when that happens, it's usually because the valves in the veins have failed. These valves allow the blood to come up against gravity and then hold it from falling back down, and when those valves fail, the blood just can't get out. It just gets stuck down in the legs, and that extra blood volume bulges the veins out.
Are there any risk factors that increase a person's potential for developing varicose veins?
Absolutely. A very common one is pregnancy. The female hormones of pregnancy, for some reason, weaken these valves and make you prone to having problems with varicose veins down the road. Genetics are also a very powerful risk factor. If your mom and dad and your aunts and uncles and your siblings had varicose veins, you're probably going to get them too. Being overweight puts stress on those valves, and that can make you prone to getting varicose veins also.
And tell me about VenaSeal and how this specialized medical adhesive is being used to treat varicose veins.
So the varicose vein with the bad valve creates all the problems. So you have 600 veins in your legs, and usually 590 something of them are working just fine. So if we get rid of the one or two which are having a problem, then we can make these symptoms people are experiencing go away completely with a very simple treatment.
Why is VenaSeal beneficial for patients?
Well, it's a non-surgical technique. It's done in the office. We don't even use a scalpel. And compared to the way we've been doing the non-surgical treatments in the past, it's still an advance because we don't use any heat in the treatment, so there's no need for anesthetics. So it's just the IV, it goes in, it comes out, and you walk to your car and you drive home. It's a really easy recovery. You can resume all your activities right away. Your only restrictions are that you can't take a bath or go swimming, but you can still take a shower. And it's very easy for patients compared to what they used to have to do in the past.
Who's an ideal candidate?
Anybody having symptoms in their legs like heaviness, achiness, swelling, those are great candidates. People who have advanced vein disease are also good candidates, such as if they have had bleeding problems or even a venous stasis ulcer.
And tell me about the success rate too with VenaSeal.
It's over 95% at 2 years.
To learn more about VenaSeal or to make an appointment, call 877-835-7938.
What is peripheral artery disease?
Peripheral arterial disease is a disease where you get blockages in the arteries in your legs, which interferes with the blood flow down to the feet. And it can cause symptoms in your legs, particularly when you exert yourself, which can be sometimes interfering.
And how do people reduce their risk of developing this disease?
Well, quit smoking if you're a smoker. Exercise, lose weight if you're overweight.
And what are the treatment options for this?
Well, there's multiple options. Medical therapy can work well in a lot of people, but if the symptoms are just too interfering, then you want to consider other possibilities. Generally, I have a bias against surgical therapies, but for some people that's the right treatment. Then there's treatments that are done through the artery in your legs, where you can try to fix it with a balloon or something that shaves the blockage out, or even stents to kind of hold the artery open.
And why do you recommend a lumavascular approach?
Well, lumavascular has some specific advantages over some of the other approaches. Firstly, it allows us to get through some blockages to be able to treat them non-surgically that otherwise would not have been possible to treat. It also allows us to selectively remove the blockage when we're treating a blockage without accidentally taking some of the healthy part of the artery.
Can you tell me a success story?
Sure. Well, I have a patient named John who was unable to work because of the blockages in his legs. And before lumavascular was available, he would have needed surgery on both legs in order to be able to walk without having symptoms. But we were able to successfully treat his legs, and he could return to work, and he felt great.
So when were you first diagnosed with peripheral artery disease?
2 years ago.
And what made you decide to treat your PAD with lumavascular technology?
Well, I had problems with my legs. I couldn't walk, my calves would tighten up, and it was just frustrating just trying to get around every day. So the doctor suggested that I try this treatment.
Tell me about the process though. How was the recovery?
Well, the recovery was fine. I walked out of the hospital the next day and I was up and moving around.
And would you say the treatment was successful?
Oh yeah, very successful.
And what are some benefits that you got from it that you noticed?
Well, for one thing, I can walk. I had a problem walking anything more than 20 yards. My calves would tighten up and I would have to take a break. Now I walk all the time.
John, that's great. And to learn more, go to DameronHospitalPAD.com.